Sorry about that. Apparently the internet connection here is really bad. Sorry. I've just changed the connection a little bit. Hopefully things would be better now. I tell you, this is the first time I'm doing it from here. So, okay, let's start again. Earlier I was saying that the COVID situation has affected professions, different professions in many ways, and as doctors we're affected quite badly too, and there are two extremes of effects. Now, on the one hand, the doctors looking after the COVID patient, mostly in government hospitals, in the public sector, really quite overwhelmed, and they have to work really hard because most big hospitals, especially in Selangor and KL, are overflowing with patients. And the government is setting up few hospitals, outlying hospitals and on to look after these patients. But unless we can get the cases under control, I'm not sure the system can actually cope with this thing. Right? So these doctors, and these are mostly young doctors, many of them have recently graduated, have to spend hours and hours looking after these patients, putting on personal protective devices and taking care all the time and being on call, looking after patients non-stop. They are really very tired with the job and everything. Then very recently this issue with the contracts have come into focus. Now I suppose this has been a persistent problem for quite some time. And years back, when I was back in Penang, I was then the editor of the Penang Medical Practitioner Society's medical newsletter. Then I raised this issue about the overproducing of doctors. And at the time, there were so many medical schools, even within Malaysia, and new ones were getting set up. In addition, a lot of people, a lot of students were going overseas to India and Russia and so on. And most of these people will return to the country on graduation. And the way things are controlled at the moment, that they are put on temporary contracts until they can get into the permanent situation. And because there are not sufficient number of posts available, a lot of them are uncertain whether they first can get into the permanent position or not, which will determine, and secondly, about the career advancement, right? Because in Malaysia, in order to get registered, we have to be, undergone all these steps, right? So without going through the process, actually a doctor cannot practice, even if a doctor thinks about going into private practice, right? Because you're not licensed to do it. Yeah? So there's a bit of a dilemma. And so recently, with the COVID situation, the focus has been put on this issue by leaders of the groups, and they are even thinking about organizing a strike to highlight the situation. And I understand the situation. They are leading the fight against the COVID-19, taking care of all these patients. On the other hand, they are worried about their own situation, whether once the contract is finished, they would have a job to go to or not. So, and some people feel that they are worse than the temporary foreign workers because there's no security, there's no benefit, and so on. So that's quite a desperate situation, and I hope that they can get a better solution to the problems soon enough. At least there is some degree of security for them, for not only their immediate future, but also for the long-term career prospect. So that's one extreme. Right? Now, let's look at the other extreme. I'm referring now to private hospitals. Right? Now, all along now, people have believed, people, including businessmen and so on, right? And some doctors, right? That no matter what happens, people will get sick, right? So the belief is that when you're in a medical profession, when you're setting up a private hospital and so on, right? There is no worry whatsoever because people will always get sick, come thick or thin, rain or shine, snow or not, right? There will always be accidents. There will always be emergencies, diseases, and so on. That is mostly true, but with the COVID-19, things have changed quite dramatically, right? Now, all along, most private hospitals treat relatively stable patients, right, with chronic diseases, and in my case, heart disease. Because I'm a heart surgeon, so I do heart surgery. Right? So now, with the COVID-19, suddenly there's a huge drop in the number of patients coming to hospitals, right, with heart disease and so on, right? And a lot of them, perhaps, being worried that going to hospital is not a safe thing to do, and so on and so forth, persist with their own medications and stay in hospital and wouldn't go for checks and everything, right? So because of that, a lot of doctors and specialists in private hospital suddenly are faced with dwindling number of patients. So now, this is especially severe in cardiology and heart surgery, which is what my main interest is, right? Now, before COVID, and I've been saying this for a long time, I was arguing that certain patients are better off having heart surgery as opposed to angioplasty and stenting. And this is the two main issue here, right? That a patient with blocked arteries, most of the time nowadays would go for angioplasty and stenting, right? And only a small proportion would come for bypass surgery. And even though many studies have shown that patients with severe disease are better off having bypass surgery, most people would still go for angioplasty and stenting, mainly because cardiology will do it, right? Nowadays, they have the devices and so on, so that even if a vessel is totally blocked, fully calcified, impossible to do in the usual way, they have their devices to negotiate the blocked arteries, to negotiate the bends and everything, and there's this thing called the drill, the rotablator, and they have this ultrasonic decalcifying tool that can soften the artery and so on, so that they can still open the artery. Right? Now, so they are, if you look around, there will always be specialists who can do this thing. So, well, some cardiologists, interventional cardiologists and so on, we're talking about interventional cardiologists, non-interventional cardiologists are not really involved in this game, right? So, interventional cardiologists, some of them are really busy, And if they've been doing it for years and years, they're so busy and they suffer various consequences from radiation and so on. Anyway, we won't go into that today. No? So, but because the workload is so high, then they will say, well, this one is quite complex. It might take a few hours for me to do it, you see. So maybe this is better off going, to see the surgeon next door and who can do the job and so on and so forth, right? So they are generous enough to do this, right? But unfortunately, with the COVID-19, with the dwindling of the number of patients, even the super successful interventional cardiologists are now facing decreasing number of patients, right? And you may know that in private practice, our income depends strictly on the work that we do, right? We only get paid by the surgery we do, the interventions, the procedures we do, or consulting patients. But actually that is only very minimal. Right? So because of the dwindling patients, not sufficient number of patients coming to them, they would, by hook or by crook, keep the patients, and they would treat them in the usual way, that is angioplasty and stenting, rather than sending them for surgery. Of course, there are always excuses, and this has been the case even before COVID, right? And they would say, well, actually, do you want to go for a surgery? You have to go, they have this open your chest, this is so long, and then your wound is so long, right? And then you have to stay in intensive care unit, for a few days, and then, your recovery will take, weeks, if you recover from it, right? And then, well, probably that's the best way to do. But if you want to consider an alternative, maybe a safer way, all right, we can do it tomorrow. I just put a stand in. After that, we can go shopping, wherever, So that is a very convincing argument for patients. And this is the argument of, whether you live longer or not, that is another issue. We'll do this first, and then you can think about that, maybe, something like that. So because of that, heart surgeons have very little things to do, right? Because the cardiologists themselves do not have enough patients to treat. And as I said earlier, their income depends absolutely on the number of cases they do. So they're not generous enough to say, well, this one, you can go for both, but maybe you should go for surgery, right? Because one case gone is a drop in income, right? And doctors are human too. They still have to live, right? And some of them have quite lavish lifestyle, and so on, right? To maintain, so they would want to continue that kind of lifestyle. So they're scraping the bottom of the barrel, right? And they are not so generous, to look after at the end of the day, we look after our own interests first before looking after the neighbor's interest, right? So this food bank result. Yesterday I saw this posting, right? We set up food bank to help people who are struggling, raise white flags and everything, right? And then some people, rather than going to the shop, say, well, just rather than going to the shop, you just go to the food bank and get all your stuff from there. Is that the mentality that we need? Anyway, that's another issue. So now, because of that, super specialists, especially heart surgeons, have find it difficult to maintain, firstly, their skill at the practice and also their income, right? Because of all these issues. And this is the other extreme of COVID-19. Whether things will change or not after this, we can't say, because once people get used to this situation, they will probably maintain it, right? So it's not going to suddenly change. Well, oh no, now there's no more COVID, so it's okay. I have enough patients, so go ahead. You can go for surgery, right? Now, so people faced various challenges. Right? So we said earlier that the junior doctors in government hospital face challenges of job insecurity, income, career advancement, and so on. And doctors in private practice also face challenges in terms of dwindling patients and their own income, which may be worse than before. So, what is the solution? Well, some people will say, well, that's where it is. They can accept it, right? Because professionals, because of their training and practice and so on, sometimes are very tunnel vision and very narrow-minded. And there are three demons, I call them, right? One is status. The other is egotism. And the third is conformity, right? So the more specialized you are, the stronger your belief in these three things, which means that you are not as likely to think outside the box, to look at other possibilities, right? But in any crisis, there are always opportunities as well, right? If you only open your mind and think outside the box. So, some of you may have an idea of what this is all about. Huh? Anyway, so that's as much as I want to say at this stage on these two extremes, which affects the medical professions. For those of you who are interested to look at other possibilities, Barbara and I are doing our Facebook Live later on today at 3:30 Malaysian time. And I hope that we can manage the technology a bit better rather than me flying solo from my clinic. Anyway, if you like what you hear here, hopefully you can leave a comment and share this, and we hope to see you again soon. Bye-bye. Take care.